Good day, and welcome to our second interview in the Equity in Action series. I'm Tom Strong. I am the director of the Employer Activation Team at the National Fund for Workforce Solutions. One of our signature programs at the National Fund is called CareerSTAT, which is a sector strategy and peer learning network that is focused on making jobs better and helping organizations be more effective in the healthcare industry. We recently relaunched the CareerSTAT Frontline Healthcare Workforce Champion Recognition Program, which has always been one of the things that people are most excited about with it. And we're thrilled right now to recognize new organizations that are creating good jobs, building equitable workplaces, and making significant investment in the skills and the careers of their own frontline workers, who we define as both clinical and non-clinical staff members who make less than $60,000 annually and have less than an associate's degree. Today, I'm really happy to be joined by George Lorenzatos, who's the Chief of Strategy and Operations at Union Health Center in New York City, which is one of our emerging champions for STAT. George, delighted to have you here. Welcome.
Thank you. Thank you for having me.
So to get started, let's start on the personal side. Could you just tell us a little bit about how you got involved with Union Health Center and this line of work?
Yeah, for sure. So, in all honesty, my background's in industrial engineering. So it's the kind of engineering of designing processes and looking at statistical now, like kind of design and understanding what works and what doesn't work from a workflow perspective, I would say. And I actually started my career outside of healthcare. So I actually started my career really focusing on telecommunications and divestitures for IBM. So, I come from a place that, traditionally is very different, right? A very different mindset, a very different kind of corporation. But I knew I wanted to go into healthcare, particularly because my senior year at college, I was fortunate enough to have a senior design project with a hospital in upstate New York, where we helped to redesign their pharmacy department, really with the insight of kind of making it more efficient and making it easier for staff members to dispense medications to patients on the floors. Based on that, I was kind of always had an eye to kind of get back into like the public sector and really work in a kind of a healthcare setting. I ended up transitioning my career from IBM to working at Montefiore, which is a hospital system in the Bronx and kind of lower Westchester, New York. In their care management organization, and really again focusing on process improvement, kind of looking through program design and strategic planning. And since then, I've been in healthcare. I've been in a few different health systems at Mount Sinai and in Northwell. And in general, I've been particularly drawn to Union Health Center, really due to its unique care model. I've worked in quite a few places, and they really are the kind of the pillar and definition of a patient-centric medical home, really kind of taking that motto to heart and that kind of design to heart. And the population they serve is really unique. It's low-wage union workers, and in actuality, my mom was a garment worker who had access to this health center years ago. So it was kind of like a way to help back my own community and folks who I know were using this place as well.
So tell us a little bit more about Union Health Center. It's been around a long time, about this unique history. Can you share a little bit more about what
Yeah, of course. Yeah, of course. So it's been about 110 years. So it was founded back in 1904 by the ILGWU, which is the International Lady Garment Workers Union. And really, it kind of is embedded in this labor movement that's happened in New York City over the last century and a decade, right? So the ILGW founded basically after a disaster called the Triangle Shirtwaist Fire, which is pretty significant here in New York City and probably for labor movement across the nation. It really was what the spark that kind of drove a lot of unions to act, unionize and kind of create actions to, create safer workspaces. And one of the first things that the ILGWU did once they were founded was, use money from dues to create a health center to treat patients for tuberculosis. Remember, a lot of their members were coming from Eastern Europe or Southern Europe, where tuberculosis is a little bit more prevalent. So when they were on the line in the workshops, they ended up getting sick, and they wanted a place where they could send their members to get better and go back to work, right? So since then, it's evolved to really be a fully fledged multi-specialty outpatient facility here in New York City. It's been in the same area for this whole time. So down in Chelsea or the Garment district, depending on who you ask. And it's really been always at the forefront of innovation. We were the first outpatient facility to do EKGs outside of a hospital. We've been on an EMR since the 90s, which is far faster than a lot of other health systems or health centers are in New York City across the nation. And again, we were one of the first to kind of pilot a lot of these innovative ideas around, care teams and kind of really creating a model that would be focused on preventative and chronic conditions.
You mentioned that term, patient-centered medical home. I just want to ask, for anyone in the audience who might be familiar with it yet, what that means in terms of UHC's operations.
Yeah, so we are PCMA certified. We were actually a organization that was piloting PCMA from the National NCQA, National Committee on Quality and Assurance, and so we were one of the not founders, I was, because it sounds like a little strange. We were one of the first organizations to get certified, and we were actually one of the organizations that helped impact the way the certifications were kind of done. That was back in, I think, 2010, around then. And really, it is a pillar of our mission, right? I think honestly, even before PCMH existed, we were always a patient-centered medical home. It was just nice to be able to finally say, like, look at us and look at what we're doing, and not necessarily, change the work we're doing, but help influence other centers to mimic us and provide the same level of care and kind of mindset to their members or patients.
I'm just putting on my headset because it sounds like folks are hearing some feedback. The medical assistant role at UHC is quite different than at other providers. Can you say a little bit more about how you develop the role, how medical assistants advance at UHC, and how you've maintained your approach over time?
Of course, I think, I would agree with you. I think when working in several different institutions, the medical assistants here do really act differently, and I think what we've done is we've really elevated the role. So, what we've done is create a career ladder for our medical assistants to become health coaches. And really how that started was back in 2008, we read a white paper by the California Healthcare Foundation, and then we ended up collaborating with UCSF, University of California, San Francisco's primary care team or group, to develop and implement the role here at UHC as well as over at UCSF. And that was around 2009 by the time we started implementing it. And really the onus for doing this was this idea of how do we expand our care team and provide additional services to our patients without overburdening our providers, our nurses, and our current MAs, right? So what we've done was we created a new role that helps to elevate the overall experience. Like our medical assistants come in clinically trained, they're all certified as medical assistants. They're excellent in their basic clinical application of receiving patients, rooming them, conducting vital signs, etc. But we noticed as we were kind of bringing on new medical assistants over the decades was that there was a little bit of a gap in their understanding of chronic conditions and really understanding how to help patients manage those conditions, right? So like diabetes or hypertension. So what we ended up doing was we created basically a basic training that all our medical assistants get on the 12 chronic conditions like smoking and kind of understanding how to do smoking cessation or the basic cancer screenings, right? So all of our medical assistants were kind of already plussed up from that standpoint where they already have a knowledge that they don't get during schooling, and typically takes a long time for a medical assistant to get on their own through kind of practice at a health center. We train them all up right away. And then what we created with this idea of a health coach was that they would get more training, they would get further didactic training on those chronic conditions, plus training really on relationship building, self-management skills, and even motivational interviewing to really help our patients really reach the goals that they need to reach to kind of manage their chronic conditions, right? They work one-on-one with those patients. And in fact, what we've done, where I think a lot of organizations kind of have health coaches and medical assistants equal to each other or kind of interchangeably, what we've done is our health coaches are independent. So they have their own books to see patients. Patients are scheduled to see them. And we've truly separated out the role of health coaches and medical assistants. Of course, all our health coaches are medical assistants, and obviously, if needed, they can step in to help cover, which is really great from a flexibility standpoint. But our health coaches are designed to be separate, and in fact, are part of the care team in whole, right? Um, what it is nice, though, it does create this career ladder. I think you heard me mentioning it before for medical assistants, right? It allows them to find additional opportunities within our organization, um, which they don't typically get, right? I think a lot of times when you look at medical assistants in other organizations, there isn't that much room for their growth, right? They're kind of stuck as a medical assistant unless they go back to school to become a nurse or an LPN, or if they choose to go into management. But from a clinical perspective, there really isn't another step for them. So we really feel this is a great way to get them to do more, continue to learn, and realistically, MAs are typically a group of people who want to do more, right? They like interacting with patients, and maybe they don't have the time to go back to nursing school, or they don't want to do inpatient. They want to stay in the outpatient facility, or they just want to stay with us. So it's been a really great way to kind of help them grow and keep them within ourselves. Um, the other thing we've been doing is constantly keeping our curriculum up to date, right? We really work with our primary care providers, PCPs here, to revise curriculum based on new findings or better approaches, and really we use our PCPs to get that feedback. A great example is like smoking cessation. Now we have to include e-cigarettes, we have to include marijuana here in New York City. It's legal, right? And there's a lot of things that 20 years ago we didn't have to talk about, right? It's different now than it was then. Um, and really we have the PCPs work with our health coaches very carefully on that. In order to kind of keep them consistently trained, our health coaches do have a separate competencies than our MAs. And a lot of times, a lot of the trainings we built, or kind of a lot of the um, care pathways, I would say, for some of these like trainings are built directly into our templates in our EMR. So it allows them um, not to have to fully think about every little thing that we've taught them. It allows them to kind of be more standardized in their approaches.
That's really helpful. And it's clear the value of this to your medical assistants. I'm curious if you can say more about how this model also benefits your patients and your providers.
Of course, I think it helps them in numerous ways, right? So I think for our providers, I'll start off with them first. Um, it allows them to have another resource, right? It gives them someone else that they can utilize to help kind of teach patients, do some work that frees up the provider time to see another type of patient, right? So it increases access in the provider template. It reduces burnout because a lot of the work that the health coaches are doing helps kind of reduce patient questions to the provider. It helps kind of increase competencies to the provider's care plans, and overall, it's just another partner in providing care to these patients. With patients, just like I was kind of mentioning with providers, they have someone else to talk to, right? We've done a really, really tremendous job in having our health coaches really be culturally competent with our patients, and really have an understanding of where the patient is coming from, right? I think it's super important in healthcare to speak the language your patients are speaking, not even just the actual language, but like in the understanding of what it means to be in their line of work, their understanding of healthcare. They're able to really kind of drill in and provide examples that they can relate to, that they can latch onto, and really help again achieve those goals. They do a tremendous job in kind of keeping them compliant to the care plan itself. And again, they're just another avenue for a patient to ask questions to without feeling, worried about the response, or a lot of times people have like this fear of asking a doctor something, or embarrassment, where the health coach is a different resource. They seem a little different. They're kind of coming at it from a different angle, I would say.
And one last question. For other healthcare organizations who might be intrigued by this model, but not sure where to start, or they have a different business structure, what are some first steps you might recommend to them?
Yeah, I mean, again, I think there is a financial component to this, right? Where you're spending a little bit more money for primary care, and I think it's always like a hard pill for health systems to swallow. But I would say start small, right? Pilot with a few providers and MAs. Start on some small topics like diabetes and to help with A1C levels, things of that nature. See how it goes. I think plussing up your MAs with kind of the general knowledge that we just talked about with the chronic conditions and getting them to understand, a little bit about care management and then kind of how do you manage chronic care, like chronic conditions, and how do you approach it with patients. That'd be helpful. Again, always kind of like as you start these pilots, listen to the MAs, what they want to provide, work with them. And again, I think overall, for it to be able to be successful, you need to get buy-in from senior management or executive management and leadership. Because realistically, with primary care, particularly in a lot of health systems, they don't see a ROI generally from primary care. A lot of times, do referrals to other specialties or through kind of like downstream revenue, they would say. But primary care is the cornerstone and foundation of any major health system, and honestly, preventative care is super important. And having these health coaches help to provide the preventative care and get a lot of these conditions under control really does help health funds and help patient systems save money in the long term. But they kind of have to look for the future, not necessarily for what happens tomorrow for the savings.
Awesome. Thank you, George. And to the audience, apologies for the feedback on my end. We are trying to resolve that, but this is a great opportunity for y'all to step in with your own questions for George as he continues to speak. So if you're in the chat, if you're in the audience, please drop your own questions about Union Health Center and about the medical assistant role, and we'll be happy to address them. George, there's a question from Rick Brooks in the chat.
So great question, Rick. So, we have kind of an advanced payment model with the union health funds that we serve. So currently our biggest health fund union work that we work with is 32BJ here in New York City. So like yes and no, we don't typically have, our payers are a little unique, I would say, is that our payers are union health funds versus the actual the Blues plans or Aetna or anything like that. We typically get money directly from the health fund itself. I'm not sure if that answered your question.
I guess related to that, it seems like my echo may have actually disappeared. George, I'm curious, just the sustainability of this model over time. Like Union Health Center has done this now for close to 20 years, it sounds like. Have you found it, it sounds like it's been sustainable for you. Have you found it easier to sustain over time as you've developed more experience with this approach?
I think so. So we just so you're aware, we have about 2 health coaches per primary care team, and our primary care teams are typically around 7 providers, 7 to 8 providers. So it's not a huge monetary investment, honestly, Tom, from a money's number. But what we do notice is that our kind of what you're alluding to, our ROI really comes from our quality metrics being phenomenal. Honestly, a lot of organizations I've worked at, just we clearly see a higher compliance rate and better overall metrics when we compare ourselves nationally through HEDIS. A good example is colonoscopy, because I know March colonoscopy is a colorectal cancer awareness month.
Right.
We have about I think 72 or 71% cancer screening for colorectal cancer. Like percentage of our patients have gotten cancer screening, which is great. Like I think it's super high. Like other organizations I've been to have been like 50% or 60%, and a lot of that is due to the fact that our health coaches can take the time, meet with patients, talk about the importance, and not just that. When we like for colorectal cancer, a lot of our health coaches will actually help guide patients through the prep, so the procedure itself is more successful.
Yeah, and when I first learned about your system, that was one of the things that most impressed me. It was clear that you were able to provide really high quality of care for your patients, and that utilizing your staff in a different way was part of the engine that made that happen.
Exactly, and what's great is that it doesn't lead to burnout for our providers, right? Again, it's something that is off the provider's plate, it's off the MA's plate, because realistically, like I mentioned, our health coaches are kind of independent. And a lot of times you would think the MA has to kind of do all this, but it's hard to juggle, I would say, intaking patients, rooming them, doing all the stuff during the visit, and then also act as a health coach at the same time.
Right. And that's something that I've seen in other systems too, when they have experimented with the medical assistant role. So a while ago, I worked with a system in North Carolina that had trained some of their MAs to be scribes when they were having a patient encounter. And the providers themselves said, this is so helpful for us because we're actually able to look our patients in the eyes and kind of connect with them fully during that encounter and provide them with better care as a result. Another question from the chat, is your training curriculum for health coaches publicly available or something you'd be able to share?
You know, I believe there is an older version that is publicly available on the internet somewhere. I think, like I'm completely honest, we do have it copyrighted, and we are working on updating it. So, like, you know, it might be available again from us directly soon. And I think we're willing to share it. I think it depends on the circumstance, obviously, and we always want to see more health coaches out there. So it's always a positive impact we can have on I would say our other health centers.
Fantastic. And thank you for these questions, Rick. Still got a couple minutes. Any other questions from the audience? And thank you all again for your patience with the technical troubles. We still do not know what happened.
It's working now, though, so that's positive.
Yeah. Well, if there are no further questions at this time, you should know that it is quite possible to continue asking questions and continue this conversation on the National Funds platform Mobilize, which we use to help bring CareerSTAT members together in between meetings like this one. And so if you are continuing to be curious about the medical assistant role, how it can be transformed in ways similar to what Union Health Center has accomplished, Mobilize is a great place to ask that question and learn from your peers about what else is working out there. And if you're not connected with Mobilize yet, just contact a National Fund staff member. Myself or Claudia will be happy to get you involved. We will also have a future kind of peer learning deep dive on this and related topics. We're going to gather George and the other kind of first two interviewees for these LinkedIn Live events and have a panel at a future date. Will be later this spring. We will let you know when that is happening through our CareerSTAT emails. The next interview will be with Loretto Health on April 10th. All of these will be the second Wednesday at 1:30 p.m. Eastern time, and that one will be April 10th. We also just want to give you a heads up for our annual convening shift, which is going to be held September 24th through 26th in Memphis, Tennessee. Registration for that will be launching in April, and we will be recognizing Union Health Center and the other 7 CareerSTAT honorees at that event. We are super excited about it, excited to see as many of you there as possible. And if there are no further questions, George, thank you so much for your time today. I learned a lot. Hopefully our audience learned a lot as well, and really appreciate you being a member of CareerSTAT.
Thank you for having me.
Take care, everyone. Thank you very much. Enjoy the rest of your day.
Bye, everyone.